I've been growing up with this pain and pain crises and falling ill and not even understanding why, even if after I go to hospital, I'm not getting better.
Joan Chazima was diagnosed with sickle cell disease at 22 years. She courageously shares a story with us about the constant battle of managing the disease.
First of all, there isn't enough information about sickle cell anemia, and most people don't know. I myself didn't understand. My mother did not understand. My other siblings never understood what this is. So yes, there has been, they've put tags on us, it's a child age 5, then 14, then not past 18. So, but then again, by the time I'm discovering I have sickle cell disease, I'm 22. And that particular time I knew I'm in my bonus years. So I was waiting for that death to come.
The red blood cells of those with sickle cell disease are sickle-shaped instead of biconcave.
A normal hemoglobin will make the red cell round, like a coin. But if you have sickle cell, it changes to a sickle-shaped or a crescent moon, right? It's an abnormal shape. So when these little sickle cells are going around in your blood vessels, in your hands, in your legs, the small veins, they get stuck. They can't squeeze their way through like the normal round ones, so they get stuck. And then they stack up one behind the other, they block. That blocking is what causes a pain crisis, depending on which bone they're blocking in. So you get severe pain crisis of the hands, the legs, the joints, the ribs, or the back.
By the time I'm discovering that I have the condition, I had just started a new job. I get a really bad attack on my chest. I could barely breathe, I could barely move. I go to the hospital, and that's when now, after the whole process of doing so many tests, and that's when, after a while we discover it's sickle cell disease. That means, number one, my job is gone. Because which employer will wait for you after like a month? You've been out. Tried to go back, they said, we filled your positions.
Pain crisis is the most distinctive feature of sickle cell disease.
Dehydration will cause pain. Stress will cause pain. Infections will cause pain. And overexertion will cause pain. You're doing something and you overdone it, because we have a limit on what we can do.
According to Grace Kiraka, clinical pathologist at MP Shah Hospital, many people living with the disease usually need a blood transfusion regularly, depending on the disease severity. The complications of the disease takes a toll on the mental health of people living with the disease, not to mention stigma. Dr. Grace says the government has also played a role in stigmatizing the patients.
People associate if you have sickle cell, you're weak, you're sick all the time, and that's not true, So then there's that stigma. There's the stigma of just, for example, health insurances. A lot of them will not cover sickle cell. They'll cover asthma, they'll cover diabetes, they'll cover hypertension. Why not sickle cell? It's just, you still need to go to hospital, you go to clinic, you might get admitted every once in a while. Why discriminate this disease and not this other one? It really doesn't make any sense.
A sickle cell patient usually exhibits signs of fever and fatigue, experiences episodes of pain, swelling of hands and feet, abdominal swelling, pale skin and delayed growth, and may also experience a vision problem. Health CAS Rashid Aman during the World Sickle Cell Day celebrated on June 19th said guidelines for managing the disease have been set by the government and stakeholders, and they are expected to be rolled out soon.
We've been trying to push that. I know the sickle cell lobby groups and the patient foundation group have been trying to push that, to push NHIF, to push the non-communicable disease department in the Ministry of Health to just consider sickle cell. Like the way you have a renal kidney program in NHIF, you have a cancer program, we should have a sickle cell program, because it's a very good defined, well-defined group of patients. We know what conditions they have, we know what complications they'll have.
Those from low socioeconomic areas struggle to afford medicine, and this includes the hydroxyurea drug, which is deemed very effective.
You discovered your bro has sickle cell.
And in Nairobi's Kawangware area, 20 years old Ozborne Odhiambo is also managing the disease.
Well, I've been on meds, hydroxyurea and folic acid, and drinking lots of water. Also, just going on with my life. Yeah.
The brother Boken Onyango does not have sickle cell disease, but had to change his routine.
The journey is a tricky situation, sometimes hard to explain, since as you see, we live on mouth, we live on hand to mouth, and I took the initiative as he's my brother, so I'm not the parent. because my parent cannot, they cannot afford to be with him.
Even though survivors go through all the complications of living with the disease, they never let that stop them from helping others in sickle cell community and making lasting change.
Me getting another lease of life means something. And that's when now the thought of now just us starting the foundation and trying to create awareness, trying to teach people on how to manage. Because every time I tell someone I have sickle cell anemia, they don't believe. They're like, no, either you're just a carrier, and don't forget I've gone through pregnancies, and the first don't on the list was do not get pregnant. So yeah, so just such things.
Is there a cure for sickle cell disease?
Yes, there is a cure. It's an interesting story. The only definitive cure for sickle cell is a bone marrow transplant, right? You take a patient with sickle cell, I'm using me as an example again. If I had sickle cell, you give me very strong chemotherapy to wipe out my bone marrow and then transplant me with bone marrow from a donor who is a match, either a sibling or a parent or, you know. And then ideally that means my body will now take this person's bone marrow and starts producing hemoglobin A instead of hemoglobin S. There's several reasons why this is not done in every patient. Number one, it's not available everywhere. So for example, in Kenya, we don't have, so you'd have to go out of the country. That's number one. Number two, this is a patient with sickle cell and you want to give them chemotherapy and wipe out their bone marrow. Are they going to survive that process, let alone just getting to the transplant, right? And this could be somebody who's doing well on hydroxyurea. So why do you want to take them when they're doing well and start throwing them to giving them a medication that they might not survive?
According to a report by the Ministry of Health, over 240,000 children in Africa die of sickle cell disease, Kenya accounting for 6,000, where 50% out of 80% die in their 5th birthday.
That mentality of, oh, all babies with sickle cell will die by 5 years, it's a changed story. We don't allow that anymore. In fact, it should be unacceptable, even right now in Kenya, to say that a child with sickle cell should not survive.
And as Kenya joins the rest of the world in marking the Sickle Cell Awareness Month, the main goal of people living with the disease is to have a better medical cover that will incorporate drug in its medical insurance scheme.